Imran Ahmad.
Mr. Deputy Speaker, I thank the Prime Minister and the Minister for Vaccine Deployment for the efficacious enthusiasm that hallmarks their sterling work in establishing over 1,400 inoculation centres and ensuring those most vulnerable will all be able to receive a vaccine soon. It is this United Kingdom's Conservative government's splendid foresight, which months ago secured vaccines far in advance of certification and rollout, that has made the UK the leading country in vaccinations in all Europe. I welcome the establishment of the large-scale COVID vaccination centre, which will shortly open in Wakefield. I commend the government's great ambition to ensure the lives, livings and liberties of the British people will be swiftly returned. Whilst we are on track to vaccinate all care home residents by the end of January and everyone over 70 and those clinically extremely vulnerable by mid-February, the challenges we face and the hazards that COVID-19 presents requires us to ever widen our ambition. Furlough and the numerous emergency schemes implemented by the government both support and cost taxpayers billions of pounds every month. The nation's rapid and effective inoculation is the only way these fearsome costs will be tamed and our lamented routine returned. It is therefore imperative everything is done to ensure everyone receives the vaccine as early as possible. At this critical stage in the battle against COVID, we must be setting ever more ambitious objectives and incentivising our dynamic private sector to capture them, rather than simply accepting prevailing limitations. The financial and human cost of this pandemic justifies and demands a warlike effort in retaliation. The Adam Smith Institute recently released a report on how to effectively accelerate the UK's COVID-19 vaccination programme. Providing a 24/7 vaccination service is one such proposal. Other recommendations include commissioning pharmacies to provide vaccine services, allowing walk-in services for spare appointments and doses, and simplifying the recruitment process to maximise the number of volunteers in the UK's jab army. West Yorkshire alone has over 540 community pharmacies with staff trained in giving vaccinations. I wholeheartedly agree with our Prime Minister and Health Secretary, who have both declared that our best route out of lockdown is through mass inoculation. This being right and true demands our national strategy be one that strains every sinew and effectively leverages and employs every conceivable mechanism that it can to increase, improve and bolster the United Kingdom's vaccination campaign.